Hello, this is Sherman Blackwell, and welcome to this week's program. This week, we recently finished our annual symposium, and we want to take this opportunity to rerun it on today's program and to inform you of all the programs and things that are going on locally and across the state concerning mental health. We hope you enjoy it. Hello, this is Sherman Blackwell, Executive Director at Singing River Services. Welcome to our annual symposium. The theme this year is Mind Your Health. We are going to present a battery of individuals that will talk to you about various programs that we have here at Singing River Services. Wendy Bailey is the Executive Director for the Department of Mental Health and has an enormous job and burden and responsibility to help coordinate and put together programs that assist people up and down the state of Mississippi. She was the first person that I thought about when we needed a keynote speaker to talk in our symposium about Mind Your Health. So we're delighted and honored to have Wendy Bailey, the Executive Director of the Department of Mental Health in the state of Mississippi.
I'm honored to be a small part of today's conference focused on Mind Your Health. In the past year, we have heard a lot about our health and wellness, and more open discussion about mental health. In the face of an unparalleled situation that affected communities all around our country and the entire world, our work lives changed, our personal lives changed, and we had to learn how to handle those changes. We began to hear more about an emphasis on how important it was for us to focus on our mental health. When so many of our neighbors and friends experienced job loss, or their homes also became their offices, and many became both the educator and parent for their children, we had to learn how to make time for ourselves. We had to be proactive in handling the stresses and anxieties of our everyday lives. It seemed more important than ever to make sure we were getting exercise or spending time outside or working on our own coping skills. Our mental health and how we maintained it was suddenly a part of so many conversations that it probably wouldn't have been in before. And words such as quarantine, isolation, and social distancing became part of our everyday lingo. The truth is that our mental health has always been important, and it always will be important. Our mental health is just one part of our overall health. We talk about our physical problems all the time. Our diet, our blood pressure, weight loss, cholesterol. Topics like these come up often when we talk about our health. But stress, anxiety, or depression seem to come up more rarely. They haven't been focused on as much as our physical health. But we all experience stress, and we all get anxious at some point or another. We experience sadness at different times in our lives. If we don't take action to handle these problems, that's when they can begin to impact our everyday lives. They are health problems whether we realize it or not. We don't ignore our physical health problems, and we shouldn't ignore our mental health problems either. About 1 in 5 Mississippians will experience a mental illness during his or her lifetime. Many times when you mention mental health, our minds may jump to a condition like bipolar disorder or schizophrenia, which are known as serious mental illnesses. The everyday issues that I've mentioned, like anxiety and depression, are much more common. We have started to grow accustomed to thinking of these as health conditions over the past year, and we should continue to do that. We should not let common misconceptions take hold. Some people have the belief that a person should just snap out of it if they are experiencing mental illness. We don't tell people who've injured themselves, who've gotten the flu, or who are managing a chronic health condition to just snap out of it. Remember that mental health problems are health problems. Genes, brain chemistry, life experiences, and family history can all be factors that contribute to both our mental and physical health. This focus on our health should not only apply to adults. Children are not immune from mental health problems. Anxiety and depression are among the most diagnosed mental disorders in children, and almost 75% of children diagnosed with depression also have anxiety. Rates of diagnosis for these illnesses have also increased over time, and it becomes more common with increased age. We know there are a lot of factors that affect a person's mental health, but we also know that people can and do find a road to recovery with mental illness. There is always hope. That is why we are here today, so we can work together to learn how to build a culture of dignity and hope, not just with the people we serve, but within our individual agencies, workplaces, and in our own personal lives. At the Mississippi Department of Mental Health, we believe that inspiring hope is one of the key factors in helping the people we serve succeed. Another key factor is helping everyone on their own individual road to recovery. Recovery means something different for everyone. When we talk about recovery, we may mention several different guiding principles, including self-direction, person-centered planning, and empowerment, just to name a few. By definition, someone's recovery must be self-directed. Everyone should be able to define their own goals and set their own path towards those goals. Since recovery is different for everyone, each person has his own individual path towards recovery, based on personal experiences, preferences, and strengths. We should make sure we are helping people feel empowered and know that they can speak for themselves and their needs, hopes, and aspirations. To help people on their road to recovery, there are more services and supports available, and more are becoming available. In the past several years, DMH has worked to support recovery and inspire hope in our communities by working to expand the availability of community services, including those on the Mississippi Gulf Coast. One of the things we've done is shift funding from our inpatient programs, such as our state hospitals, to allow for greater access to programs and services at the local level. 2 years ago, Mississippi had 8 crisis stabilization units around the state. There are now 13 with plans underway for more. In Jackson County, Singing River Services opened 8 crisis stabilization beds in Gaucher. These crisis beds are essential in helping people remain in the community. Last year, the crisis stabilization units across the state had a diversion rate of 91%, meaning less than 10% of the people served there went on to a state hospital. The state has also seen increasing use of mobile crisis response teams, which are now available in all of the state's regional community mental health centers. These teams respond to someone in a timely manner wherever someone may be experiencing a mental health crisis, whether that is at their homes or if the team members need to meet someone at a local hospital. They first began operating in 2014. And last year they had a total of 36,921 contacts, including more than 20,000 face-to-face interactions. We've also worked to make intensive community supports more available. These include programs of assertive community treatment, or PAC teams, intensive community outreach and recovery teams, which we call ICORT, and intensive community support services, or ICSS. We have worked to make sure at least one of these services is available in every county in Mississippi. In Region 14, George and Jackson counties, they have intensive community supports provided through ICORT and ICSS. DMH first piloted the ICORT program in 2019, and in 2020 we expanded that to 6 teams statewide, including the team in Region 14. These teams are similar to PACT in that they provide services in the community for individuals with serious mental illness who have not always benefited from other outpatient services. Because of the success of the ICORT program here at Region 14 and at the other 5 sites in the state, DMH funded additional teams this year. In addition to these intensive community services, we have worked with our state's community mental health centers and other partners on several other programs, supported employment services, housing services, and peer support programs. There are children's services available like wraparound facilitation, the Navigate program for young people experiencing their first episode of psychosis, and juvenile outreach programs. In short, there are more services and supports than in the past, and our local providers and partners are essential in helping Mississippians get the services they need. At the Department of Mental Health, we will continue to work as hard as we can to make mental health services available in our state. But one thing we can all do is to encourage people to get treatment when it is needed. Remember that a mental illness is a health condition that affects someone's thinking, mood, or behavior. It is a health condition just like any other. People can and do recover from mental health problems. Treatment and recovery are ongoing processes, but the first step is getting help. The past year has been difficult. Things are getting better, but we don't know when they will be back to what we would have called normal in 2020. It's more important than ever to focus on our health. Let's remember that our health includes our mental health. Get the help we need when we need it, and maybe most importantly, encourage others to do the same.
Hello, I'm Michelle Crevier, Clinical Director of Singing River Mental Health Services. Singing River serves the communities of Jackson and George counties and has done so for over 40 years. Singing River Services maintains a holistic, person-centered approach and offers specialized services for people with serious mental illness, people with intellectual developmental disabilities, and people with chemical and other addictions. Some of the services that we offer are our therapeutic services, which include an initial assessment and individual, family, group, and multiple family group therapies. This is a face-to-face interaction where a therapeutic relationship is established with a qualified therapist and a plan for future services is created. Mental health targeted case management provides information, referrals, and resource coordination for people and their families or other supports. These services are directed towards helping the person maintain their highest possible level of independence and monitors the person's individual service plan. Community support services are community-based mobile services directed towards adults, children, and adolescents and their families. These services focus on the person's ability to succeed in the community, to identify and assess needed services, and to show improvement in school, work, family, and community participation. These services are person-centered and focus on the person's recovery and ability to succeed in the community. Intensive community support services differs from community support services by engaging in community settings with people who have severe mental health functional impairments and who have traditionally been managed in psychiatric hospitals. The intense community specialist maintains a low caseload so they can provide services multiple times per week as needed. Research shows that work plays a critical role in improving people's quality of life and mental health outcomes. Singing River Services offers supported employment to people in our communities who are diagnosed with a mental illness. This process of helping to secure and maintain employment begins with the idea that all people are capable of working in the community. Certified peer support specialists are people who have received or are currently receiving mental health services, or they may be a parent or caregiver of someone who has experience with raising a child with an emotional, mental, or behavioral disorder. A peer support specialist works with the families in the community to promote hope, personal responsibility, empowerment, education, and self-determination. The peer support specialist has a lived experience and can share their own recovery in assisting others to succeed in obtaining mental health stability. The peer support program also offers transition services from hospitals, crisis stabilization units, or other institutions into the community with mental health care. Community support and peer support can assist people in obtaining resources for housing, transportation, disability, education, food, mental health, and much more. These services are primarily provided in the community rather than an office setting. Our Jackson and George County services include the intellectual developmental waiver programs and community support programs. These programs assist people with IDD or autism to live successfully at home and in the community. Oftentimes, these people have dual diagnosis, which includes mental illness along with intellectual or developmental disabilities and/or autism. The Stevens Center is a residential drug and alcohol facility located in Jackson County. Services provide people with drug and alcohol addictions as well as co-occurring issues. This is defined as people who have a drug and alcohol diagnosis as well as mental illness diagnosis. Our programs include intensive outpatient, individual therapy, medical assisted treatment, primary and transitional residential treatment, diversion from hospitalization, referrals to detox facilities, and more. Singing River Services offers a multitude of options for paying for our services. Most anyone in your community will qualify for our services. Please stop by and see us so we can help you to determine what is the best course for your mental health well-being.
Hello, I'm Linda Bradley, Director of Outpatient Services in Jackson County. So I'm going to introduce a few services that are offered at Singing River Services. So the first one that I'm going to start with is our Intensive Community Outreach Recovery Team. This is also known as I-Court. And with our I-Court services, these are services that specifically target individuals with a severe and persistent mental illnesses. You do have to meet criteria for admission into this particular service. And so we do have team members that can evaluate you for this service to make sure it is a good fit for you. And you do not have to be currently receiving services at Singing River Services to be evaluated. I'll give some examples of some of the qualifiers for this service. For example, if you've had multiple psychiatric admissions within the past year, if you are unable to successfully perform like your activity of daily living, if there's some type of functional impairment in those areas, if there's been maybe some high-risk criminal involvement, those are just some examples of what could be qualifiers for this service. The team does consist of a registered nurse, a therapist, a certified peer support specialist, and also a community support specialist. And you will also be under the supervision of a doctor as well. And you will learn different therapeutic, interventions. And these are on an intensive level. And you'll get multiple contacts and interactions with your treatment team just multiple times a week. And so if you think that this would be a service that you or someone you know that could benefit from this, then please don't hesitate to give us a call and we can, set up an evaluation. So the next service that I'm going to introduce to you is psychosocial rehabilitation. This service is also known as PSR, formerly known as Clubhouse, so you may still hear that term. And what this service is, it's a day program that generally operates between the hours of 8:30 and 1:30. And this is also designed for individuals that have a persistent mental illness as well. And this is for adults. And for the psychosocial rehabilitation program, the purpose of the program is to promote recovery, resiliency, and there's a network of services and activities within this particular program that the individuals participate in, and they learn a variety of skills. Now, these skills are derived from evidence-based curriculum, and so these are evidence-based activities that the individuals will participate in. Some of them include like relapse prevention skills, how to build social supports. You learn specific symptoms and behaviors that are associated with mental illnesses. You also learn coping skills that are designed to reduce the stress of the mental illnesses that you may be experiencing. Emphasis placed on the importance of consistent use of medications. And so there's just a number of skills that are learned throughout this particular program. Transportation is provided to and from the program if needed. So if you think that psychosocial rehabilitation is a service that you would like to be a part of, please contact a member of your treatment team, or you can contact our office to learn more about it, and we can get you signed up. So the next service that I'm going to introduce to you is our crisis services. Our crisis service, this is an intensive therapeutic service that allows for an assessment to be made on an individual that is experiencing some type of mental distress. It could be some type of behavioral distress that's going on. If they're experiencing any emotional distress. This is available 24 hours, 7 days a week. And what we will do is actually, triage the individual, and we'll make like a clinical decision on, the best intervention or treatment option for that, person that's experiencing the crisis. And again, this is available 24 hours, 7 days a week. So it does not matter what time of day, what time of night. If a person is in need of crisis service, we are available. We also provide mobile crisis as well. So it doesn't necessarily have to be, a phone assessment. It can also be a face-to-face assessment. Please don't hesitate to give us a call on our crisis line. And we can be reached at 228-497-0690. And this service is available to you 24 hours, 7 days a week.
Good morning. My name is Debbie Smith, and I'm the Regional Children's Director for Jackson and George counties. We would like to welcome you to our symposium today. I will be covering services available to children in Jackson County and George counties, as well as all services in George County. As many of you know, May is Mental Health Awareness Month. May the 7th was Children's Mental Health Awareness Day, so we have worked extremely hard to get the word out about mental health and services available to someone in need. Mental illness includes many different conditions, ranging from mild to severe problems. Left untreated, the outcomes can be devastating, not only for the individual suffering, but the family as well as the community in which they live. Suicide is the third leading cause of death in youth ages 15 to 24. Over 90% who complete suicide has a mental disorder. States spend nearly $1 billion annually on medical costs associated with completed and suicide attempts. Juvenile and criminal justice involvement continues to be on the rise. Youth with unidentified and untreated mental illness more often end up in jails and prisons. It's estimated that 75% of youth that end up in juvenile detention center has at least one mental illness. When children with untreated mental illness becomes adults, they generally use more health care services and incur higher health care costs than other adults. Research shows that early identification and intervention can reduce the long-term disability of mental disorders. Recovery is possible. Here at Singing River Services, we offer an array of services to children and youth. Our primary focus is the recovery model of treatment, which is individualized based on the child and family's needs, and assessment of the symptoms. Services that we provide for children and youth in both Jackson and George counties are individual therapy, group therapy, family therapy, community support services. We provide day treatment service, medication evaluation, and we provide crisis support services, target case management services. We offer parenting classes, and we offer threat assessments for the schools in both Jackson and George County. We do pre-screening evaluations as well. We have master's level therapists and bachelor's level community support services available for all of our school districts. We work very closely with the schools in both Jackson and George County. We go into the schools and provide services to children in need. We also have a therapist and community support service specialist located at the Juvenile Detention Center here in Jackson County. I would like to also mention that our summer day treatment programs will be offered to at-risk children beginning May the 27th in Jackson County and June the 1st in George County. The program is operated from 9 to 2 Monday through Friday. We will offer transportation, breakfast, lunch, and snacks daily. We will be working on social skills, anger management, self-esteem, impulse control, and interaction skills with others. If you have a child or you know of a child that is in need of mental health treatment, please call Jackson County office at 228-497-0690 or the George County office at 601-947-4274. They will be happy to direct your call to the Children's Service Department. I would like to now talk about all the services offered in our George County office. We offer most all services that Jackson County office offers, with the exception of drug and alcohol inpatient and the crisis stabilization unit, which is located in Jackson County. Individuals needing these services from George County are referred to our Jackson County office. The George County office has been extremely fortunate to be able to offer the same services as our larger Jackson County location. This doesn't always happen in other regions, and we are very thankful that we are able to provide all these services. Dr. Blackwell and the leadership staff of Singing River Services has ensured that George County receives all services available. The George County office provides, we provide assessments, individual therapy, group therapy, community support services. We also provide PSR elderly program, and we're currently located in the Glen Oaks Nursing Home. We're looking to expand these programs. So many times our elderly will not get the mental health treatment they need once they go into a nursing facility. We're trying to close those gaps. We provide PSR adult programs, and we also provide IDD services. And with the IDD services, we provide home and community-based waiver services, which include day services and supported employment and supported living. We provide crisis services and medication evaluation, as well as pre-screening evaluations. If you need any of these services, please don't hesitate to call the Lucedale office at 601-947-4274 to make an appointment. Thank you so very much. Have a nice day.
Greg Fox, DO. I am a provider here with Singing River Services, Region 14, serving Jackson and George County. I work very closely with our psychiatrist, Dr. George Davis, and in this capacity, we have a medical clinic here in Goshen as well as in Lucedale, Mississippi, as we also serve George County. I also oversee our medication-assisted treatment program, where we prescribe buprenorphine products to patients that have an opiate use disorder, as they have become addicted to pain medicine. And with the rise in overdoses and the opiate epidemic, it has been a very, very productive, life-changing and saving program for many people here in Jackson and George County. People are able to get their lives back and get their families back, get back to work, and become once again productive citizens. As well, we have a crisis stabilization unit here in Goshen that is almost 2 years open, where we also, through our crisis line and our med clinic, if somebody is in need or is in distress, whether it be that they're suicidal, psychotic, just not able to function in society, and they could be, for their own safety, we will admit them and treat them in-house. As well, we have an alcohol and drug residential treatment program, and I go there 2 mornings a week and oversee that program as far as on a medical standpoint. It's been a very challenging year with the pandemic. We have a crisis line that is 24 hours a day to serve this region. If anybody is in need of any services, really we treat almost anybody that is in need.
Hello, my name is Beth Finnick, and I am the Assistant Executive Director of Singing River Services. I'd like to thank you for joining us today and allowing us to share with you. Everyone will encounter challenges during the course of their life that can and will affect their mental health. This includes stress, anxiety, depression, all which ultimately can affect our ability to care for ourselves, our families, maintain relationships, and adjust to daily life changes. It's important that we prioritize our mental health as much as our physical health. Mental health and substance use disorders are just as common and treatable as physical health problems such as heart disease and diabetes. However, people are hesitant to talk openly about mental health and substance use. Mental health issues are often misunderstood. A lack of awareness and understanding can result in misinformation, fear, and negative views of those with mental illness. It can result in feelings of hopelessness, shame, rejection, isolation, and self-doubt for those who are experiencing these symptoms. This can be extremely overwhelming for someone who is struggling with a mental health condition. Because people are not comfortable talking about these issues, and there is a lack of understanding and acceptance, it often prevents or delays them from asking for help. It's estimated that fewer than half of the people who experience mental illness get the help they need, which can significantly diminish quality of life. Ignoring problems do not make them go away, and some conditions may worsen over time without the proper treatment. When someone begins to recognize issues that are negatively affecting their thinking, mood, or their emotional or psychological health, or symptoms that interfere with their day-to-day functioning, it's important they pay attention to these signs and ask for help. The sooner people get treatment, the greater their chances are for recovery. The community mental health services offered through Singing River Services have been a part of making recovery a reality for people experiencing mental health and substance use issues for more than 45 years. We're committed to prioritizing the recovery needs of individuals and families to help in moving forward from mental health and substance use issues and improving quality of life. Our goal is to help people achieve this through receiving treatment in their community and based on their individual needs. Singing River Services is here to provide the essential mental health care to people who would not otherwise be able to access the services any other way. So please remember to mind your health. If you or someone you know is struggling with mental health or substance use issues, I encourage you to ask for help. Life can be difficult for all of us. You don't have to struggle in silence. We are here to help.
We certainly hope you enjoyed today's program that gave you a look at what's happening with mental health issues in our state and locally. And of course, we want to remind you of the number that you see on the screen. That number is available to you 24 hours a day, 7 days a week. We're going to look forward to seeing you again next week with a special guest.